Hi, I'm Eric Burlison, and I'm here in the Missouri House Chamber, where I have the honor and privilege to represent you. Healthcare and health insurance has become so expensive that very few people can afford it. One of the myths that others are trying to sell you is that if we collectively send our money to Washington, D.C., it somehow grows like yeast. The truth is that if we can't afford it, neither can D.C., because we're paying for the bill anyways, either now or later. Government programs like Obamacare have only proven to mess things up and cost us more. Did you know that Americans spend more per person on their health care than any other nation in the world? Obamacare has only made it more expensive than ever before. Instead of more government programs, we need to focus on addressing the real costs so that you can actually afford health care and its insurance. One of the costs that is built into every visit that you make to your doctor is that doctor's liability insurance. You know, as a business owner, I understand the importance of having insurance and want every doctor to have enough coverage for the sake of their patients. The problem, though, here in Missouri is that it's getting more and more difficult for doctors to be able to afford their liability insurance, and that's passed along to you and I in the cost of our care. And the reason for this is that Missouri's legal system is still kind of operating like the Wild West. When your doctor or healthcare provider is sued, there's no limit on what the plaintiff can be awarded for in what's called non-economic damages. We all know that if a doctor has made a mistake and is found to be liable, they ought to pay for the medical needs, lost wages, and any other real expenses from that incident. But there are creative attorneys who sue for non-economic damages called pain, suffering, and emotional distress. And it's an amount that can be unlimited. This pain and suffering amount is added on top of the actual damages. For years, Missouri did have a cap in place of $350,000 for pain and suffering, and it worked well. Unfortunately, the 2012 courts threw it out for technical reasons, and that put our healthcare system into turmoil. The reality is that we all end up paying because when there is an unknown risk, costs go up and doctors leave our state. The bottom line is if a person is injured because of a visit to their doctor, I want them to be taken care of. But getting injured shouldn't be like winning the lottery. It's a bad prescription for all of us. For more information, please go to my constituent website at ericburlison.net. That's ericburlison.net. Thank you.